To begin our program, I would like to first welcome to Dr. Leigh Gabel. She will enlighten us about the significance of bone health during childhood and adolescence, as well as the vital role physical activity and exercise play in cultivating a healthy skeleton. Dr. Gabel is an assistant professor in the Faculty of Kinesiology, and her research is largely centered on crucial life stages for bone accrual, such as childhood and adolescence and bone loss during menopause. I'll be listening to that in particular. Please join me in welcoming Dr. Leigh Gabel as she shares her research and insights on the pivotal role of physical activity and exercise in promoting healthy bone development throughout our lives. Dr. Gabel.
Thank you, Lisa. And thank you to everybody for being here today. My talk is titled Planting the Seeds for Healthy Bone Development. So I thought I should start with a picture of a connection to the land. And actually, I'm going to use this to talk about how we can learn about building healthy bones from this windswept tree. This windswept tree and the ones around it are pretty near and dear to my heart. This is an image from Beausoleil Island on the rocky shores of Georgian Bay in Ontario. I spent a number of years here at a summer camp and then working as a summer camp counselor. But I'm sure you all can envision that image of a windswept tree, whether it was hiking in Kananaskis or along the windy plains of the foothills. What can we learn about trees? Well, trees and most of their features are largely determined by their genetics. So we can tell this is a pine tree. It looks a lot like other pine trees. It looks a lot like the upright pine tree that you would find in the neighboring dense forest. But it's also susceptible to its environment. So the water, the sun, the soil, and particularly the forces it experiences while it's growing up. So we know that this windswept tree grew this way because it was pushed on by the wind as it was growing. So growing trees adapt to their environment. And like trees, your bones adapt to their environment. So your skeleton, the density, the size, the strength, is largely determined by your genetics. So you can thank your biological parents for a lot of those factors, but it is also susceptible to the environment. There's a number of factors we could talk about today, but I'm going to talk about one, and that is movement, how you move your body. And across your life, your bones are continually adapting to the way that you move. And particularly during childhood and adolescence, they are really adaptable and really susceptible to the way that you are moving. And that's where I'm going to start with today. So before we begin, why do we care about building better bones? I'm sure you can think of a few good reasons for your skeleton. One, it supports you. It's the reason that you can move around. It's an attachment site for muscles, so those muscles allow you to move. It also serves protection, so it protects your vital organs, it protects your brain. Your bone marrow live in your bones, so they produce red blood cells, white blood cells, platelets, and it's also a reservoir for minerals. So an example of this is a growing fetus. So the baby develops a skeleton. It needs calcium to do that. And it actually borrows, or more appropriately steals, some of that calcium from mom's skeleton. So of that 1,000 milligrams that you're recommended to intake every day, near the later stages of pregnancy, that baby is appropriately stealing about a third of it. So we know moms are really generous and unselfish, but this starts right from the get-go. And then even more, lactation, breast milk. What is milk made of? Calcium. Where do you think that comes from? So mom's diet, but also from that reservoir of calcium in the skeleton. So we know that bone plays a really, really crucial role in many different functions. Okay, now this is the audience participation of the talk. Given how important your skeleton is and how many roles it serves to play, how much do you think your bones weigh? Either think of a number in kilograms or what percentage of your total body mass represents your bone. I'll give you a second to think about it, and then if any brave souls would mind venturing a guess, please go ahead. 10%? Okay, and any others? Yep. 30%. 45. Those are wonderful guesses. Do you know what? It's actually only about 3 to 5% of your total body mass. So maybe only 2 to 3 kilograms of bone mineral. You could hold that in your hand. What is the rest of your body? Well, if you're a young male, so an 18-year-old male, for example, about 80% of your body mass would be lean mass. So that's muscle. Those are your organs. Those are fluid. Then you have about 15% body fat, and the remaining 5% bone mineral. For a female of the same age, about 70% lean mass, so muscle, organs, fluids, about 27% body fat, and then 3% bone mass. So we actually don't have a lot of bone mineral in the body, and it serves really important function. So absolutely, we're interested in building better bones. So now I'm going to come back to the purpose of my talk, and that's to talk about movement and movement during childhood and adolescence. I'm going to show you a video of a young gymnast who I know quite well. And gymnastics is a sport that we tend to think about when we're thinking about movements that help build a strong skeleton, because we know that gymnasts have denser and strong bones. So what do you see happening here? We're seeing a lot of impact. And impact is when your body experiences a load greater than your body weight. And these loads squish the bone, and that sends a message to the bone to get stronger. The body and the bones need to be squished in order to get stronger, and we sometimes refer to this as overload. So we need squishing our load over and above what is normal or what the bone is expecting in order to encourage it to grow stronger. And we know that you don't have to be a competitive gymnast to reap the benefits. Even recreational gymnasts tend to have denser and stronger bones than non-gymnasts, just by virtue of how they're moving your body. The other cool thing about gymnastics is look at this movement, the loading on the arms. There are very few other times in life where we're actually putting that much load on the upper body. Can you recall the last time you were even hanging from your arms or trying to push up with your full body weight? So this is something really unique to gymnastics. Now, you don't have to be a gymnast to reap these types of benefits. You can find these movements in everyday life, during free play, when kids are given the opportunity to. You can see the impact, the squishing of the bone. And bone needs this squishing in order to grow strong. Now, I often think about whether kids innately know they need this type of movement, because whenever given the opportunity, you'll find them jumping on things they're not supposed to. Right, so I've convinced myself that they just know their body needs this movement. It's not that they want to sort of bug me by continuing to jump on the things they're not meant to. Another place we often see these movements happening is when we get outdoors. Kids rarely take the easy path. They're climbing on top of rocks. They're jumping off them. They're exploring their environment. And in this video here, this is not our first trip to the park. This is not the first time my son is jumping off of tall things, but this is the first time he's climbed this high and gained the confidence to go for this type of a jump. And he ends up going up for more, and his comment is, whoa. And, you know, the whole time during this, I'm trying not to say, watch out, be careful, because, you know, I don't want to stop him from doing it. If the volume was there, you would have just heard me say, like, how are you feeling about this, buddy? And he was like, good, I'm good, right? So this type of movement is really key to building strong bones. Jumping is a really nutrient-dense type of movement. Let's take a look at another sport that you might be familiar with. And tennis, or any type of racket sport, is really interesting because you get this repetitive loading. So back and forth. But what's particularly unique about it is that it only happens on one side of your body. So it's unilateral. So we can look at differences in how bones adapt in the playing arm versus the non-playing arm. So this is a CT image of the upper arm, the humerus, showing the bone in one female tennis player. Can you guess which arm is the dominant arm? Yeah, it's pretty obvious, right? It's a lot larger, wider bones. And this brings up the concept of specificity. So bone adaptation is specific to the bone that is being loaded. And tennis players and racket sport players make this really clear. We're going to stay on the tennis playing theme right now. What I'm showing you is some data from side-to-side differences in bone strength in adult females. So an adult female who did not play tennis is indicated here as a control. So this would be someone like me. I probably have a 5% difference between my right and my left arm just by virtue of using my dominant arm more. Now, if we look at side-to-side differences in tennis players, these would be tennis players who started not in old age, but they started after puberty. So they started in their late teens or in their 20s. And we can see that the side-to-side differences that they have are much greater than you and I who aren't tennis players. But then when we look at side-to-side differences in adult females who started playing before puberty, we're seeing up to 25% or greater bone strength in the arm that was being loaded. Now, these data come from people of the same age who trained for the same number of years. The only difference is that training was initiated before puberty or during late childhood, early adolescence. So this brings up the concept not only of specificity, but also of timing. And the timing of loading matters, and there's what we call a window of opportunity in childhood and adolescence where kids are really receptive and responsive to this type of impact and squishing. Why is this the case? So I'll show two slides illustrating how bones grow. And these are data from the University of British Columbia Healthy Bone Study, where I did my doctorate. And what we're looking at here is total body bone mineral content from a DEXA scan. So the same scan you would go to screening for osteoporosis. And we have data on over 1,000 kids who we followed from childhood right through to early adulthood. And every little line here is an individual child. The girls are in black, the boys are in orange. I was on a bit of a Halloween theme this past week. And the thick black lines would be the average curve for girls, the average curve for boys. And you can see I mentioned we might have about 3 kilograms of bone mass at adulthood. So this is 3,000 milligrams, or for girls, closer to 2,000 or 2 kilograms. So a few things you'll notice from this figure. One, boys tend to have on average a lot more bone mass as they enter adulthood, and that's largely because they're taller. Second, we don't stop gaining bone mass until typically our early 20s. So the rate at which we accrue it slows down, but we're still gaining bone mass into our early 20s. And then most of this bone mass is being accrued between the ages of about 11 to 15. So sort of this window where a lot of bone is being accrued. And what happens during these years really sets the upper limit for where your bone mass and density will be to see you through a lifetime of loading. So this next slide, these are the same data, but instead of showing you bone mass in grams, I'm showing how fast that bone was being accrued. So we're looking at grams per year of this total body bone content. So we see that in girls tend to hit their peak of bone mass accrual around age 12, boys about 2 years later, around age 14. And this is just because girls tend to enter puberty a couple years earlier than boys. What's pretty interesting is that this peak for boys is about 330 grams per year. Now, total bone mineral content is around 3,000, so that is more than 10% of their total bone mass they're gaining in just 1 year of adolescence. That's huge. When we think about how fast you grow in height, you might only be gaining about 5% of your height when you're growing your fastest, maybe 8 or 9 centimeters. But we gain so much more bone mass because bone is not only growing to lengthen your bones, but in other places, it's being added to widen your bones and make them more dense, depending on how they are being loaded. Now, there's a lot of variability in terms of when kids enter puberty. So these are just average ages, but it can fluctuate on either side by a few years. But we tend to call these periods from about 11 to 13 in girls and 13 to 15 in boys as these real windows of opportunity for bone accrual, because it's during these ages, bone is being added its fastest, and it's just primed to adapt to loading. Now, I do want to touch on just one more thing, and that is, I'm often asked, is there such a thing as too much physical activity? We know the benefits of physical activity, but sometimes we're concerned that our kids are engaging in too much. I don't have enough time to go into specificity, sport specialization, or overtraining, but our next speaker, Dr. Edwards, will talk a little bit about that. But I do want to talk briefly about the importance of the menstrual cycle and menstrual function for adolescent girls and young women. So I'm going to talk about 2 different conditions that are totally different. One is anorexia nervosa. The other is oligoamenorrheic athletes. I'll tell you what each is, but each is associated with impaired bone strength and a higher risk of fractures. So those with anorexia, it's a life-threatening mental illness that's characterized by restrictive eating. So not eating and starvation. When the body doesn't have enough energy or isn't eating enough, and you're growing, you don't have enough energy to build new tissue. So you're not building bone. You also don't have enough energy for reproductive function. So often your menstrual cycle will stop or it'll become irregular. And why that matters is because there is one hormone in particular that is very important for bone health, and that is estrogen. And in women, it is produced primarily in the ovaries during the menstrual cycle. So it gets produced in the follicles. When you are no longer having a cycle or it becomes irregular, estrogen declines, and that leads to bone loss and greater risk of fracture. So we know that youth with anorexia tend to have fractures more often than their non-anorexic peers. And then oligoamenorrheic athletes. These are athletes in weight-bearing sports. So their skeleton should be strong compared to the average because they've been loading them. But oligoamenorrheic means that they had a menstrual cycle at one point, but it is now irregular or it's been absent for several months. Usually in athletes, this occurs because of not enough energy intake, so not eating enough for the level of activity, or excessive exercise, or too much physical activity, or chronic stress. So again, this leads to a condition that we know is bad for bone. When we think of sports associated with this condition, we often think of those aesthetic sports, so gymnastics, dancing, and figure skating, where leanness is really prioritized. But we also see it in weight class sports, like rowing or boxing, where you have to make weight in order to compete, or in running, where you're carrying your body weight. So in these populations, we see that rate of fracture is approximately 40%. So that means 40% of the youth or young adults have broken a bone. There's no difference in rates between the athletes and those with anorexia. And this actually doesn't tell the whole story because many of these have had multiple fractures. Then having multiple fractures puts you at greater risk of having more fractures down the road. And this compares to about 20% in the non-athletic population. So what we see here is that loading the body through sport cannot protect you from the negative impact of estrogen deficiency that's associated with not having a menstrual cycle. So I think this is a really important conversation we need to be having with our adolescent girls and young women in terms of the importance of this for bone health. And lastly, I want to leave you with an image of bone health across the lifespan. So we've talked about enhancing bone accrual during childhood and adolescence through movement and moving the body. Into adulthood, we're really talking about maintaining that bone mass So just because you gained it during childhood doesn't necessarily mean that it will be maintained. You still have to keep moving your body. And then I have building bone in brackets, because you can build bone as an adult. It's just a lot harder to do so. And then later in life, we think about reducing bone loss and preventing falls. And I want to hone in on one point in particular, and Lisa alluded to this in the introduction. Right here in women, at menopause, we see this precipitous decline in bone loss. Now, we usually don't screen for osteoporosis until age 65. We know there's a lack of knowledge around women's health in general, but particularly around the menopausal transition, and there's very little guidance what to do in this period to prevent this loss from happening. So I want to put a brief plug that we're just about to start recruiting for a strength training study here in Calgary that will look to see if we can prevent bone loss during peri and early menopause with strength training and impact loading. So I'd love to chat with you afterwards if this is something that might interest you. So with that, I'll come back to the image of the windswept tree. Our skeletons are a lot like trees. Genetics plays a large role in determining our size, strength, density, but our bones are also susceptible to how we move them, and particularly how we move them during childhood and adolescence. So we know how to build better bones. We just need to move them. Thank you.
Thank you.
Thanks, Lisa.
Thank you, Dr. Gabel. Wonderful. And yes, I will chat with you later about a test subject. I'd be happy to be part of that study.